especially for my young patients, because I treat a lot of young cancer patients, I will often, because they're devastated by the diagnosis, I'll often recommend an antidepressant very early on. And I'll tell them, we're just going to use this to get you through the treatment. This is not long-term treatment. And it's to help you deal with some of the problems that I know they're going to encounter. And I have to say, for my younger patients that are open to that treatment, they get great relief from some of those drugs. My older patients are a little bit reluctant to do that. It's probably generational. And unfortunately, what I find is those patients have such severe pain. They go through all this treatment. They end up very, very depressed. And then, of course, as I mentioned in my quote from Frank Turnbull at the end, is that the pain is heralding the specter of death. They know it's coming. And so then there's this impact of anxiety, but also depression. Can't sleep. We know that those things lead to increased pain. So it's really a difficult cycle to break. What I do tell my patients, and this is in my own practice, there's nothing in the literature that I know that supports this, is I want them out of bed every day. I don't care how difficult it is. If they can walk around the block, that has a huge impact. If they can go to the gym and get on the treadmill for 15 minutes, makes a huge impact. What I don't want them doing is sitting in that dark room that I described. So they get a lot of benefit, at least anecdotally, from getting out and trying to find something in the day that makes it worthwhile, or even sometimes they feel happy about. I've had many patients, so I have a patient right now that I'm treating for tonsil cancer, and she told me that her son is getting married to the end of June. She said, get me to that point. When they have times like that, you know, that's what we work toward.